Welcome to Ask the Specialists on CMU Public Television. Tonight, choosing wisely, the 5 questions you should always ask your doctor. That's next on CMU Public TV. Hello and welcome again to Ask the Specialists. I'm Mike Horace, and tonight we are discussing the Choosing Wisely campaign, a campaign to inform patients about the 5 questions they should be asking their doctor. We have a whole panel of guests to answer questions about choosing wisely. Let's meet them now. First, we have Dr. Ernie Yoder. Dr. Yoder, welcome. Tell us a bit about yourself.
Thank you. I'm a general internist and went to medical school at Wayne State and spent the next 3+ decades in the Detroit area and at Wayne State before moving to Mount Pleasant and joining Central Michigan University to help start our new College of Medicine.
Next to Dr. Yoder, we have Dr. Madhura Mansabdar. Doctor, welcome. Tell us about yourself.
I'm an internist and have been in clinical practice for about 14 years. I currently am medical director of the Mid-Michigan Collaborative Care Organization, where I lead initiatives to help improve processes and quality of care, as well as reduce costs in the delivery of healthcare within our system.
And finally, we have Dr. Ron Gonzalez. Doctor, welcome to the program.
Thanks, Mike.
Tell us about yourself.
Well, I'm a family medicine doctor. I've been in practice for 14 years up in St. Charles, a little town over by Saginaw. I graduated from MSU College of Human Medicine and very excited to be a Sparty this year, especially. I'm involved with Covenant Healthcare Systems up in Saginaw in their PHO, involved in several committees, in particular our Organizational Systems of Care Committee, our Clinical Integration Committee, and the chairman of the Specialist Committee, where we are working towards trying to engage specialists to get involved in our clinical integration systems. And we're using the Choosing Wisely campaign as a means to try to approach them.
So let's introduce our guests to the Choosing Wisely campaign. Dr. Yoder, can you describe what exactly is Choosing Wisely?
Choosing Wisely is a campaign that is co-sponsored by the American Board of Internal Medicine's Foundation as well as the Robert Wood Johnson Foundation. The key purpose or the focus of the campaign is to improve doctor-patient communication by creating opportunities for improved conversations between patients and physicians. So there are the 5 questions. The goal is to make sure that for each patient it's the right medical decision, treatment, or diagnosis for the right patient at the right time.
Where did this idea come from?
So this emanated from the ABIM Foundation, the American Board of Internal Medicine. It relates to 2 campaigns that they were supporting. One was the creation of the Professionalism Charter that was published in 2002, and the other is work to promote the patient-centered medical home. In the patient-centered medical home, a team of individuals, health professionals, provide care for each patient, focusing or basing it in the relationship of the patient to the team, led by a primary care physician. And the idea is to activate patients so that they take responsibility, an increasing level of responsibility for their care decisions.
And this is really a national effort, isn't it?
The whole thing is a national effort.
All right, Dr. Mansabdar, what is the consumer impact of this campaign? Why should patients be paying attention to it?
Well, consumers or patients, when they are, need to pay attention to this because of many different reasons. Firstly, as we order more tests and procedures, the overall cost of healthcare goes up. And they are part of the cost of healthcare, and they pay for portions of this in the form of copays, deductibles, and coinsurance. Additionally, there may be tests that are ordered that potentially have side effects for them. There are impacts of every test, including radiation exposure and other such things that they need to be aware of. And then thirdly, when employers offer health insurance and health insurance costs go up, employers have to decide between wage increases and offering health care. And so this impacts the consumer again.
So as we mentioned, there are 5 questions that patients should be asking their doctors. And Dr. Gonzalez, the first question is, do I really need this test or procedure? Why is that an important question to be asking your doctor?
Well, I think it's an important question to be asking your doctor, and not only that you're asking your doctor, but the doctor is considering every time that they order a test, prescribe an antibiotic, or recommend a treatment. Why is this important? And I think it's important because of the overall cost and overall quality that we're providing for our patients. The Choosing Wisely campaign helps to organize that with this list of recommendations based on evidence-based recommendations, and provides a basis for us to have that discussion with our patients. It's important because of the cost that's involved, because of the quality of care that's involved, because of the risks that are involved with all these tests and all these treatments that we provide.
I'm wondering, how often are unnecessary tests and procedures being ordered by doctors? I'll open that to any of you.
Sure. So there are various drivers of unnecessary tests. There's defensive medicine. Physicians are worried that if they don't test, that they might be viewed as culpable and might be the subject of a lawsuit. Patients, we have a very educated group of patients that come to our practices now. They see things on television and on the internet, and they ask for things. They're asking more questions and requesting more tests. There's a tendency for people to believe, both lay and to some degree professionals, that the newest technology is always the best, always the right test. And so these are drivers, various drivers of overuse. And overuse is both expensive and risky, because tests are not perfect. They are representations of reality that are not reality. So there are false positives and there are false negatives. False negatives are risky because we miss a diagnosis or miss an opportunity to help someone. False positives are problematic because it requires us then to do further testing and to hopefully find out that indeed the initial test was a false positive. So these all together drive up the inappropriate use of tests and treatments and drive the cost of health care, as well as exposing patients to unnecessary risks.
What are these unnecessary tests and procedures costing our healthcare system every year?
So there are various estimates that range from $500 billion to $800 billion a year. If you look at total cost of expenditures, or total expenditures on healthcare in the U.S. are estimated last year to have been $2.8 billion. So we're approaching 20 to 30% of the total expenditures on healthcare.
Dr. Mansabdar, I'm wondering, are the patients somewhat responsible for all of these unnecessary tests and procedures? Is there a mindset among certain patients that they need to have every single test?
Well, to an extent, patients may be responsible. When a patient has insurance and has a particular medical condition, they may feel that it is their right to get this test. On the other hand, if someone is struggling with a symptom like chronic pain, for example, they want to know why they have chronic pain. Why? They want to get to the bottom of it, find a reason. Sometimes the focus may be getting really to the root of the problem, looking at it as, can I potentially get this cured? Is there something that's being missed? And then there is, of course, the fear of the unknown. If they feel that there is more that can be done to try and find out, and they have the insurance to cover for it, they want it.
If I may add too, I think at the bottom line, we have the power of the pen. The doctors in the office have the power of the pen. It's our name that goes on the bottom line when we order tests, when we order an antibiotic, when we order treatment. So it is our responsibility to help guide these patients. What's the right thing to do? And choosing wisely, as I said before, it provides that evidence-based recommendations to back that up, what we're saying, what we're recommending, and what we're doing. I also might add that you asked the question of what is involved in ordering these tests. Do doctors order tests that are unnecessary? And reading an article a couple weeks ago about the educational process of doctors and how we are almost ingrained. It's ingrained in us to order more things than less. As we're going through the educational process, we get dinged and we get harped on if we're not ordering the right tests, if we're not asking for certain procedures to be done. Where on the other side, we don't necessarily get dinged if we're ordering too much. So there's an educational process that needs to take place there and a reevaluation of how we're approaching these things on the doctor's side as well.
As we look at these 5 questions that you should always be asking your physician, the second one is, what are the risks associated with a given procedure, a given test? And we've touched on that a little bit. Wondering if you can elaborate on that. Dr. Mueller or Madura, that's fine.
Certainly, there are risks to different tests that are being ordered. For example, if someone has chronic low back pain and they're ending up getting an X-ray ordered, there is, for one, radiation exposure. This is especially important for people, men and women in childbearing age, because of exposure to the reproductive organs. There is additionally accumulative long-term exposure of radiation, which increases the risk for cancer. There is additionally a cost involved again, that they may be sharing a portion of that cost. And then thirdly, there is the anxiety associated with getting a test and then receiving results. Many times tests that are ordered will show up other conditions that may seem worrisome but aren't actually worrisome, and these will then trigger additional tests or expensive referrals to consult specialists and further tests.
So really causing unnecessary stress for patients.
That is correct.
And in addition to that, there are risks increment as we become more invasive in our testing. So some tests require injection of various contrast media. There's an opportunity for allergic or toxic reactions. And many of our modern tests involve actually insertion of catheters, violating, if you will, the integrity of the skin and inserting catheters into our vascular system or other systems of the body. And each of those tests has risks as well as costs. And so it's incumbent upon us to be sure that they are fully indicated and that the results of the tests are likely to cause us to change what we would do for and with a patient.
There are also global risks as well. As we prescribe inappropriate antibiotics and we increase the resistance rate, that affects the population-wide. So there's global risks involved, not only to the patient with side effects of antibiotics, but to everybody.
All right, our third question that we're going to look at is, are there simpler, safer options? Dr. Gonzalez, can you start with that?
Yeah, as we approach, for example, as we approach trying to decide what is the best test to do, I think we always have to consider what is the benefit that we're going to get out of that test, what is the amount of information that we need to derive the proper treatment. If, for example, we're looking at somebody with abdominal pain and considering appendicitis, do we do a CAT scan at a much higher cost, or do we do something simple as an ultrasound at a much lower cost and less risk exposure to the patient? So there's situations like that where we can use simpler tests, less complex tests, get the appropriate information with less risk to the patient.
There is a philosophy in management of certain conditions, such as, for example, chronic low back pain or chronic migraine headaches, where really testing more is not the answer, and it changes our focus away from the management of the condition, which would actually help improve outcomes, to just trying to find out the reason. But some of these things do not have a reason. We know that. There are no other underlying conditions that necessarily predispose or increase the risk for chronic migraines, for example. If we already know that the patient has chronic low back pain, the need is more for perhaps physical therapy, exercise, simple pain relievers, where we can move on and focus on management.
The next question that people should be asking their doctors is, what happens if I don't do anything? Is doing nothing sometimes the best course of action?
So I would say that this really gets at more than one question that needs to be considered with a patient. One is this a time for watchful waiting? And what is the likelihood that either a positive or negative test result, if we're talking about testing, is going to change the things that the patient and I would be wanting to do for them? if we're considering a diagnostic test, what are the alternatives and what are the risks and benefits of each of those alternatives? And is one truly better than another? And so it requires us as physicians to understand how the tests operate and what is the likelihood that a positive test really means the condition is present. What is the likelihood that a negative test result means that we can safely say that the condition is absent? Mm-hmm. So we need to consider all of those along with the actual costs for the patient and for the system each time that we're ordering a test.
Is that a concern that certain conditions might go undiagnosed because of that watchful waiting that you're doing?
I think it is a concern. If we do, and physicians do, I believe in general, do due diligence. In other words, we're collecting the data in a systematic fashion based upon what the patients can tell us, and we build the kind of communication and relationship with our patients so that they tell us all the things that we need to know from them, and we're doing a full physical. I think it puts us in a position of being able to define the risk, the likelihood of a highly risky condition versus low-risk conditions, and it makes us both more comfortable. And then communicating with the patients, making sure that they're comfortable reaching back out to us should things change or not progress in the way that we anticipate, we're in a position to then interact with them and to take action.
Dr. Gonzalez, are there some procedures and tests that are very common today that don't need to be as common as they are?
There's quite there's quite a few of them. As you look at the new recommendations for, say, mammograms, pap smears, things like that, there are, there are some tests that that we've been doing as kind of a knee-jerk reaction and just as a matter of standard. Mammograms every year, pap smears every year, that the newer recommendations have been out for a while, that we don't necessarily need to do those. We can do pap smears or mammograms every other year, pap smears every 3 years in certain age groups with the appropriate with appropriate conditions.
Are we seeing some of these tests being ordered less frequently now? Are doctors becoming better educated?
So the clinical guidelines that are published by our various specialty societies have gradually changed over the past decade as we've got increasing amounts of data on larger numbers of patients and identify real risk factors so that we have the ability to stratify the groups of patients that we see and know very low risk from very high risk. And so we design the preventive component, the screening, testing, and so on, to be specific to an individual patient based upon their needs and their risks.
And yes, to answer your other question there, yes, doctors are beginning to order lesser tests, especially not just lesser, but more appropriate tests. And where they are not necessary, where they are beginning to have conversations, thanks to campaigns like Choosing Wisely, which has been led by Mahaya in our area. Physicians are coming together and increasingly having these conversations with their patients.
The final question that patients should be asking their doctors is, how much does it cost? Why is that one so important?
Again, it is very important because overall healthcare expenditure has been increasing in our country. It has outstripped the rate of growth of the GDP. And the more money that we spend on healthcare, the less we have for other important services like education, public services. Additionally, patients bear a burden of some of this cost too. And so as healthcare costs go up, especially if 30% of the healthcare expenditure is thought to be potentially wasteful, there is a substantial portion here that we can effectively work on without compromising quality of care in any way.
As the structure of our healthcare system changes and co-pays go up, deductibles go up, I think patients are becoming more and more interested in what's this going to cost me, doc? How much is this going to cost me if you send me out for this test? So they're becoming a little bit more interested in what's going on and what we're asking them to do. And it's the things listed in the Choosing Wisely campaign, that helps as a jump off and as a discussion platform to discuss those issues.
Right. I know many people have insurance, so their costs are relatively limited as to what they have to pay a doctor, but these kind of costs show up in their premiums, don't they?
Right. They do, and in fact, diagnostic studies are the last to kind of come forward with a copay where the patients actually have out-of-pocket expense. Initially, copays were started, in the physician's office. We all pay our $10, $15, $20 as our share of a physician visit. More and more in hospital services, patients were paying, but the diagnostic studies, regardless of whether they're imaging or laboratory otherwise, were the last for patients to actually have a stake in, if you will. And I think as a result, there's been a greater propensity to say, look, I don't have to pay for it. Let me have that MRI versus, a physical exam.
Right.
But now with health insurance exchanges and where patients are beginning to purchase health insurance themselves, and these are high deductible health plans, they have a very substantial portion that they are now responsible for as we're moving forwards. And so they, just like Ron mentioned too, they are increasingly interested in the cost because they do share a burden of that expenditure.
Right. We focused a lot on patients so far. I want to hit on two other groups. The first one, your fellow doctors. What should they be doing to engage patients in these questions, especially if maybe the patients aren't asking the questions themselves?
I think it starts with the preparation for each patient-physician visit. And as a physician, it's our job to, with the patient, set an agenda for the visit. An important component of that agenda is leaving time at the end to make sure the patients have time and are invited to ask questions and to encourage them to interact with you and to ask questions. Things like, what if we don't discuss? Will you get to your car in the parking lot and realize, I forgot to do this, or I'm upset because I didn't ask the question?
And physicians do play a critical leadership role we are stewards of the healthcare dollar. Mm-hmm. And as we move forwards with campaigns like Choosing Wisely, they have developed specifically patient-friendly brochures that are available for physicians to be able to engage in these conversations more efficiently, because the average primary care physician has about 7 to 10 minutes with a patient. And in that much time, to be able to engage in those additional conversations can be fairly taxing. These types of brochures have been very helpful. We have specific brochures designed for antibiotic use in patients with sinusitis, or radiologic studies for patients with chronic back pain, or evaluation of abdominal pain. And these brochures can be easily handed out. They have evidence-based information that is easily accessible for patients and helps them understand why certain tests may not need to be done.
Dr. Gonzalez, we've got just a few minutes left, so I wanted to ask you about why businesses should be involved in this campaign. Why is it important for employers to encourage their employees to have these discussions with their doctors?
Well, I think cost is an issue, and then the business owners, they bear the burden of the cost of what it costs to provide health care to their employees. That's one issue, but quality is a big issue as well. Are they getting the best quality care, the best cost-effective medicine that they can get? So they should be interested in those.
And I would add also, a healthy workforce is critical to businesses in the region. So to be able to make sure that their employees are able to get to work and to function fully at work so that they're productive, is part of the cost benefit of employing their workers.
I know some of these conversations are sometimes uncomfortable for patients to have with their doctors. They might be uncomfortable for the doctors themselves. Do you have some advice on how to make these conversations easier?
Yeah. If I could get back to one of the things that Dr. Yoder mentioned about preparing the patient for the visit. And yes, you can make this easier on the patient. One of the things that we do in our office is those brochures that Madura mentioned. We have those in our waiting room, and the preparation starts in our waiting room, where it used to be a bunch of old magazines. We've had the staff pull those out of there and put the Choosing Wisely brochures out in the waiting room on colonoscopies, on mammograms, on pap smears, so that the patients have that to read before they get into the room and start that preparation for that visit.
So you're starting them on this as soon as they walk in your front door?
As soon as they walk in the front door, yeah.
What kind of resources are out there available for patients to turn to maybe before they get to the doctor's office?
So there are a number of websites, the American Board of Internal Medicine, the American Academy of Family Practice, American College of Physicians, WebMD, et cetera. It's amazing the resources that are available to patients now so that they can find out information about themselves, their potential conditions, the symptoms or signs that they may be having of some disorder, so that they become a better participant in their own care when they see their patients, or excuse me, when they see their physicians.
Additionally, Choosing Wisely has a very well-prepared website, and it's choosingwisely.org. There is also Mahia, which has promoted this campaign in our area, and that's mihia.org or .com. And then Consumer Reports. It comes off of the Choosing Wisely website, where Consumer Reports have produced patient-friendly brochures, so patients can access these themselves too.
And if doctors are looking for more information, can they turn to similar sources?
Absolutely. These are structured to, and in fact, there generally are sections of each of the websites that were just discussed that are focused for patients, the lay public, as well as for professionals. And it takes professionals frequently to the grassroots research that is the basis for the recommendations.
All right. Well, that's all the time we have for this edition of Ask the Specialist. We'd like to thank our doctors, Dr. Ernie Yoder from CMU, Dr. Madura Mansabdar, thank you so much, and Dr. Ron Gonzalez. Thank you so much for joining us. We'd also like to thank Gary Bellotti for his help in setting up this show. Thank you to our producer, Stephanie Mills, and our director, Matt Ozanek. I'm Mike Horace. For everybody at CMU Public Broadcasting, have a great evening.